Hey y'all, it's Julie, the nursing tutor. I've got some NCLEX practice questions on endocrine assessment. It's a little bit all different kind of stuff. And here we go. So the role of the endocrine system in regulating metabolism. The endocrine system is made up of groups of cells whose primary function is to synthesize and release hormones directly into the bloodstream and body fluids. These hormones are transported by the blood to various parts of the body where they act on the cells to control the cell's physiologic function. All right. So, how does the endocrine and nervous systems regulate the body processes? The endocrine system typically controls body processes that occur slowly, like cell growth. The nervous system controls body processes that occur more rapidly, like breathing and body movements. And you're free to mute me. I know some of you just want to hear my little voice. Okay. Primary endocrine dysfunction means that an endocrine gland is either over-secreting or under-secreting hormones. And situations where this happens are referred to hypersecretion, hyposecretion, you know. Okay, you ready? Age-related changes to the endocrine function, select all that apply. The pituitary becomes larger, metabolism declining, blood glucose levels rising, decreased levels of epinephrine, or decreased levels of thyroxine. You got your answer? Look. B, metabolism declining, and when you get old, it sure does. Blood glucose levels rise, decreased epinephrine, and decreased thyroxine. Help us, God. Okay. The various body processes in which the endocrine system is involved include, select all that apply, regulation of metabolism, growth rate, physical development, sexual function, or reproductive processes. You got your answer? All right. Every single one of them, all of them, does everything. I mean, your hormones, yeah. Endocrine disorders are caused by, select all that apply, overproduction of hormones, long periods of limited mobility, underproduction of hormones, severe viral infections, and effects of certain drugs. Endocrine disorders are caused by which of those? Somebody had a gun to your head and said you had to answer it. What would you put? Well, it is overproduction, underproduction, and certain drugs cause it. The effects of drugs like steroids can cause endocrine disorders. All right, here we go. Oh, that's the same one, ain't it? Okay, so I'm stuttering, sorry. All right. A patient is undergoing a test that will employ contrast media. Which finding in the patient's health record should be reported to the doctor before the examination? That the patient wasn't NPO last night for 6 hours, the patient takes potassium supplements, the patient's food allergies include shrimp, or the patient didn't take his morning dose of antihypertensive medicines. Yeah, you know, your butt puckering. Look, He got an allergy to shrimp. Shrimp, betadine, anytime. And look, anytime we're shooting contrast media in somebody, they have to have a signed consent on the chart. You can't fart unless they give us permission to, with that, to move forward anyway. So before administering testing of a contrast media, the nurse must ask about allergies to iodine, which is betadine, shellfish. An allergy to either one of those may indicate that they could have a hypersensitive reaction to that, and their throat could close. Father God, then what you gonna do? I'd check. A patient is admitted with suspected endocrine disorders. His symptoms include changes in blood glucose levels, weakness, and irritability. Diagnostic procedures to determine etiology of the problem will include X-rays, lab studies, ultrasound, or MRI. Got your answer? Hopefully they'll all be that easy. Serum levels of endocrine-releasing hormones will be most significant in diagnosing the patient. X-rays and ultrasounds are useful when they think there's growths or tumors, but we go in blood first. You right? All right. If a disorder is a primary endocrine gland disorder, the gland is secreting inappropriate amounts of hormone due to the defect in the gland. The gland is secreting inappropriate amounts of hormone as a result of changes in the pituitary. The target cell fails to respond, or the primary gland is causing dysfunction of the secondary gland. We just said that a while ago. Yeah, I hope you got it right. So look, I know I should have made it bigger. Primary endocrine dysfunction means that an endocrine gland is over-secreting or under-secreting. Situation, yeah. Tumor or hyperplasia of an endocrine gland may lead to hypersecretion. Tumor or hyperplasia, overgrowth. Hyperplasia means growth. Hypersecretion is usually the result of a tumor or an inflammatory process that destroys the endocrine glandular tissues or interferes with the endocrine gland function. Infection, mechanical damage, or autoimmune response may cause such an inflammatory response in a gland, but you got it right. Which glands are part of the endocrine system? I would be able to list them. What if that was a bonus problem? Thyroid, occipital, parathyroid, adrenal, pituitary, or frontal. You got your answers? Boom. I know you saved them. All right. What is the name of the substance secreted by the endocrine glands? Vasoactive amines, chemotaxins, hormones, or cytotoxins? You know. Here we go. Which mechanism is used to transport substances produced by the endocrine glands to the target tissue? Lymph system, bloodstream, direct seeding, or gastrointestinal system? Yeah, you know. Saved them. Which hormones are secreted by the thyroid? I'd be able to list them. Calcitonin, somatostatin, glucagon, thyroxine, which is T4, aldosterone, or triiodothyroxine, which is T3. What do you reckon that 3 means in the 4? It means it's got 3 molecules of iodine in that one, in T3, and 4 in T4. T4 is actually the inactive form. It's got to lose a molecule of iodine to become T3. Okay. So you got your answer? I hope you got it. Yeah, A, calcitonin. Calcitonin makes calcium go back in the bone from the blood. Calcitonin make it go back in. Hopefully that helped. And then T4 and T3. A patient has a low serum cortisol level. Which hormone would the nurse expect will be secreted to correct this? TSH, adrenocorticotropic hormone, or ACTH, parathyroid hormone, or antidiuretic hormone? They got low cortisol. B, cortisol comes from the adrenal cortex. So if you didn't know, but you knew cortisol was a glucocorticoid from the adrenal cortex, then, I mean, just as a, a Hail Mary, I'd have picked it because, I don't know. The target tissue of antidiuretic hormone is which organ? Hypothalamus, thyroid, ovary, or kidney? Boom. Which statement about hormones and the endocrine system are accurate? Select all that apply. I know these suck, but if you do enough of them, you'll get over the vomit that comes up in the back of your throat. There are specific normal blood levels of each hormone. So really, when you get one of these, you're making this, is that true or false? If it's true, then we're going to select it. If it's not, then, we're not. Hormones exert their effects on target tissue. Each hormone can bind to multiple receptor sites. The endocrine system works independently to regulate homeostasis. More than one hormone can be stimulated before the target tissue is affected. And endocrine disorders are always related to an excess of one or more hormones. All right. Pause it. Pray about it. And get your letters. Because here we go. You ready? A, B, and E. There are specific normal blood levels. Hormones exert their effects on specific target tissue. They're not just out here just ding-a-ling-a-ling in everybody's receptor. There's specific receptors they ding-a-ling, okay? And then more than one hormone can be stimulated before a target tissue is affected. Okay. The binding of one hormone to a specific receptor site is an example of which endocrine process? A lock and key manner, negative feedback mechanism, neuroendocrine regulation, or fight or flight response? Yeah, it's a lock and key. Fits just right in there. And look, can't just any key be going up in it. You see that? I mean, it's got to be the right. Okay, I'm giving it to you, all right? Which statement about pituitary hormones is correct? ACTH acts on the adrenal medulla. Okay. Adrenocortico works on the adrenal cortex, not the adrenal medulla. Follicle-stimulating hormones stimulate sperm production in men because sperms is their follicles. Growth hormone promotes protein catabolism. Remember, catabolism is cutting it down. Vasopressin decreases systolic blood pressure. Vasopressin is man-made ADH. Diuretics make you pee. Antidiuretics make you not pee. So it's not going to decrease the blood pressure. Hopefully that'll help. Which endocrine tissues are more commonly found to have reduced function as a result of getting old? Select all that apply. Hypothalamus, your ovaries, testes, your pancreas, thyroid, and parathyroids. Oh, I gave you the answer, my bad. But look, so lock it in your brain. Ovaries, age just wearing the crap out of it. Testes, pancreas, and your thyroid. Yeah, they just shoot their wad in your 20s, and then in your 50s, they're like, what? Which statement about age-related changes in older adults and the endocrine system is true? All hormone levels are elevated. Thyroid hormones levels are decreased. Adrenal glands enlarge, and the thyroid gland enlarges. Yeah, B. It decreases. All right. In the older adult female, which physiologic changes occur as a result of decreased function of the ovaries? Decreased bone density and estrogen production, decreased sensitivity of peripheral tissues to the effects of insulin, decreased urine concentration ability in the kidneys, or decreased metabolic rate. Hopefully you know what the ovaries do. You got your answer? Yeah, it's going to be A because they produce estrogen and progesterone. I mean, none of this, thank goodness it didn't have nothing else. If all you knew was the ovaries made it, you could pick out what was wrong Sometimes I can pick the right answer because I know them other ones ain't it. But anyway, what is the correct nursing action before beginning a 24-hour urine collection for endocrine studies? Place each voided specimen in a separate collection container. Check whether any preservatives are needed in the collection container. Start the collection with the first voided urine, or weigh the patient before beginning the collection. You got your answer? It's B. Check whether whether it needs a little something in the container. This one, start the collection with the first void. Actually, you will throw the first void away and then start the time on a 24-hour urine. Why do you do that? To ensure that we are beginning this test with an empty bladder. And then every piece of pee comes out of them. It's got to go in them brown things, and they should be sitting in ice, and number them. And then every so often we're going to draw lab work and stuff, and they're going to compare the amount of what they're looking at in the blood and in the urine and see how well their kidneys are functioning. So, but anyway, I believe you're picking up what I'm putting down. Which instructions are included when teaching a patient about urine collection for endocrine studies? Select it all. Fast before starting the urine collection. Measure the urine in milliliters rather than ounces. Empty the bladder completely and then start timing. Time the test from exactly the instructed number of hours. Avoid taking any unnecessary drugs during your endocrine testing. And empty that bladder at the end of the time period and keep that specimen. You got your answers? And look, if you're going to get it wrong, this is where you want to get it wrong at. Because you sure enough going to know the right answer. Okay, C, D, E, and F. Empty the bladder completely and then start the time. But you're going to throw that first void out. Time the test from exactly the instructed number of hours. It's 24. If you start at 9:30, we end at 9:30. Avoid taking any unnecessary drugs. Don't do heroin while we're doing these endocrine tests or anything else. I know it's inappropriate. Okay. And empty the bladder at the end of the time. Keep that specimen. Pour it right off in there and then lock it all up. Oh, I hope you liked it. Okay. Let me know if that helps you. If you have any specific questions, I've got... if you have any specific questions about any certain thing like negative feedback or something, let me know. And I have the pituitary gland. I have questions like this busted up. Let me know how you like those, okay? Thank y'all for watching.